In this lesson, we will do a little introduction to abnormal psychology. In order to be diagnosed as having a psychological disorder, there has to be certain criteria present, and we call these the 3Ds. So, first of all, the behavior that the person is exhibiting must be disturbing. So it has to be deviant, unusual to the norm. Second, it also has to cause the person great distress. So worry, doom, harm, dread. If both of these criteria are present, we call that a neurotic disorder. Now, someone with a neurotic disorder has a mental illness, they have problems, and they know they have problems. They just can't help it. An example would be an eating disorder, let's say bulimia. A bulimic is someone who eats a large amount of food and either vomits the food up or uses laxatives to get rid of it, that binge purge cycle. So that behavior is unusual, disturbing. We call that deviant behavior. And it also causes the person a lot of distress. They are so focused and worried about gaining weight, so that they have that constant stress, that constant worry. That's a neurotic disorder. They have this issue, they have this problem, but they understand that they have a problem. They just can't help it. Now, the third criteria, dysfunctional. This is where the behavior is impairing your ability to function on a daily basis, hold a job, establish relationships, etc. If that is present, we call that a psychotic disorder. This is when one loses touch with reality. So what's going on in their mind is very different from what the reality is or what you and I would be experiencing. An example here might be schizophrenia. Somebody with schizophrenia, as you will learn, has hallucinations and delusions in many cases. So they see and hear things that nobody else can. However, in their mind, it is very real. But their behavior has become dysfunctional or psychotic, and they have lost touch with reality. In ancient times, obviously, they did not have an understanding about what mental illness was. In order to attempt to explain one's irrational behavior, they would say maybe it would be the moon or lunar cycles causing the abnormal behavior. Or it could be the gods controlling the behavior. Again, not understanding what a mental illness is. In the Middle Ages, this was a very religious time. You had to go to church or you would be excommunicated and banished away from the community. So in Western Europe, it is the center of life. And during the Middle Ages, as you recall from history class, most people were illiterate. They could not read or write. Only the clergy who worked in the church could do so. So if church is the center of life and they also lack the knowledge of what a mental illness is, when someone was acting irrational, they often believed that maybe the person was demon-possessed or it was due to evil spirits. Many historians believe that a lot of exorcisms that priests performed in the Middle Ages were not on people who were actually demon-possessed, however, had a mental illness. Some treatments that were used were very brutal. Many of them would be mutilated, castrated. As I said, the exorcism, they were put in cage, they were beaten. It was an embarrassment to the family. So these people were not treated very well. Some blood transfusions or mutilation took place. Another treatment that was used was called trepanning, especially during the Middle Ages. If you thought the person was demon-possessed, had evil spirits inside of them, then if the exorcism didn't work, perhaps you could drill a hole in the skull and the demons or evil spirits would fly out. This was a very common practice, and you can see the tool that was used to drill the holes here on the right. Once mental hospitals were starting to emerge during the Renaissance period, They still were not like mental hospitals that you would see today. Again, it was an embarrassment for families to have a member who was acting irrational and believing there was nothing really you could do for these individuals. They were often locked up and put in these very horrific mental hospitals that were more like dungy prisons, where they were treated like animals. They were usually chained or put in cages, and nobody ever went back to visit. Here are a few of the cages or chairs that the individuals would have been placed in, and the thought was that if you could confine the person and prevent them from acting irrational, that somehow the behavior would stop. And we do know now that that's not the case. So you're going to see the first transformation from these barbaric prisons into a more modern type of mental institution take place in France in the early 1800s. The man who advocated for this change was a man named Philippe Pinel. He went around and visited these barbaric mental institutions and wrote about the conditions to raise awareness and pleaded for a change. He believed that instead of locking them up and putting them in cages, that people could actually be diagnosed. You could talk to them, you could treat them, and maybe even cure them. And this was known as the medical model. Not just locking them away, but let's talk to them and try to figure out what's caused this and how we can change that behavior. Here in the United States, that doesn't take place until the latter part of the 1800s after the Civil War, and Dorothea Dix is going to be the person in the United States who advocates for that change. Dr. Rosenhan in 1973, he was a psychiatrist, and he believed that conditions in mental institutions were still unsatisfactory and that people were given a stigma when they went into mental institutions, and once you got in, it was very difficult to get out, and they were forever seen as mentally ill and really inhuman also. So he and a few of his colleagues were pseudo-patients. They started to say to other physicians they were hearing voices, and they were admitted to mental hospitals with a diagnosis of schizophrenia. And after being admitted, they said that they weren't hearing the voices anymore and that they were fine, but they found it was very difficult to get out. So the Diagnostic and Statistical Manual of Mental Disorders lists all of the psych disorders, and they're categorized into 5 different groupings or types. We are in the 5th edition. The first edition was released in 1952, and it contained 106 disorders. It's been revised, as I said, several times. We're in the 5th edition, which was released last year. In that edition, there are 297 disorders listed. In the DSM, you will find a description of the psych disorder and the prevalence. So you'll find symptoms and what to expect if someone had this disorder, as well as what percentage of the population would suffer from that mental illness. You will not find cause, and you will not find treatment. That is up to the individual psychologist who is treating a specific patient to determine what caused and therefore what type of treatment they should give. So in the DSM, you will find 5 axes or chapters, basically. In the first chapter or axes, it will list all of the primary mental disorders, so anxiety disorders, bipolar disorders, schizophrenia, somatoform disorders, dissociative disorders, depressive disorders, etc. In the second chapter or axes, you will find personality disorders, which are very different than the other primary disorders listed in Axis 1. You'll learn about all of these in a few upcoming lessons. Axis 3, or Chapter 3, is the person's medical condition. Do they have any medical condition that could be contributing to their disorder that they've been diagnosed with? Axis 4, or Chapter 4, this is about a person's life circumstances. It describes psychosocial and environmental factors that may affect the person. So maybe occupational problems, economic problems, educational problems, support group, looking at people in their environment, etc. Chapter 5, this is or Axis 5, this is a global assessment of functioning scale. So this is basically a rating on how the individual is doing from 0 to 100. 100 means that they have no symptoms and they're doing fine. Obviously, the lower you go on the scale, the more of a danger they are to themselves or society.